Hi, I'm Dr. Chuck with Your Filthy Mouth. Blood clots and your mouth, are they connected? Stay tuned, find out.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, welcome to Your Filthy Mouth. I am Suzanne Lynn with Dr. Chuck, and today we're talking about blood clots. And I guess if you can kind of explain to us, without being too complicated, what exactly is a blood clot, and are they all bad?
Well, we need the blood to clot at the right time and place. So if you cut yourself and it starts bleeding, you want the blood clot to form right there. That's okay. But you don't want a blood clot to form inside of your arteries, inside of your veins. That's not a good place for the blood, because it stops the flow of the rest of the blood.
Okay.
So, and there are several things that can cause a blood clot. I mean, if you've got a cardiovascular disease and you get a little tear on the inside of that artery, your body tries to repair it. And as it repairs it, it forms a little clot. And if that clot breaks loose, if it goes to the heart, it's a heart attack. If it goes to the brain, it's a stroke.
Oh, wow.
So,
okay. And you were just talking about the fact that, I mean, there's some bacteria that's traveling in these blood clots.
That's another thing. They want to find out, is there oral bacteria in some of these blood clots? And here's a study that was done April the 5th of 2019. So this is a relatively new study.
Yeah, just a few months.
This out. Yeah. I'm going to read you the title of it, then we'll explain the title.
Okay.
It says, Oral Bacteria Signatures in Cerebral Thrombi of Patients with Acute Ischemic Stroke Treated with Thrombectomy. What that means is these people already had a stroke, and they were able to go in and retrieve that blood clot. And then they wanted to see what is in that blood clot.
So biopsy it or whatever kind of.
And then do DNA testing to find out what bacteria is in there. And they found that 86% of these clots had oral bacteria in them. That's not a coincidence. That's a high number.
Wow.
86%.
That is very high.
So what's oral bacteria doing in a blood clot?
How did it happen? How does it get there?
Well, again, it's not rocket science. Every infection we have in our body, whether it's in your foot, your hand, or your mouth, all infections produce pus. What is pus? It's harmful bacteria, dead tissue debris, dead white blood cells, inflammatory proteins, and some other toxins. Where does the pus go? It either drains out and you see it, or it drains in and you don't see it, but goes into the bloodstream. So this pus running through our bloodstream eventually can cause some other issues. And they're proving right here that, one of the things it's affecting blood clots.
I have to go back to the image of when the pus runs out of us, whether it's a pimple or a sore or a scab or something. That's alarming to us.
Yeah. Yep.
But at least it's exiting our body. When you're talking about bacteria in your mouth, it's entering our body into the bloodstream, and it's going everywhere.
And it doesn't hurt. The older I get, the more I like pain. I know it sounds crazy from a dentist. I never want to cause pain.
Right.
That's the absolute bottom thing.
Right.
But pain is one of the best motivators I have ever found. The number one reason people don't see a dentist is lack of pain. Everything is fine. Well, you have this pus running into your bloodstream 24 hours a day, 7 days a week, literally for decades. And eventually something's going to happen. It could be a blood clot. It could be some other issues that you have going on. But they're proving that the blood clots in these people that had strokes all had, or 86% of them had oral bacteria in them. So that's quite alarming. And all of this is preventable. And that's the thing I want to say. We can't focus on what we can't do, but we sure can focus on what we can do. And what we can do is have a healthy mouth. And we're not talking about a Hollywood smile.
Right.
Just go in there, spend that 5 to 7 minutes every day really doing a great job cleaning your teeth. Check yourself with disclosing tablets. I'm a huge fan of disclosing tablets, so you can see if you take a test and it's never graded, how do you know how well you ever did?
Right.
So this way you can grade yourself, and nobody's going to look over your shoulder. You can do this yourself. But, clean that mouth up so that you can avoid some of this, because a lot of this is preventable.
When I think about strokes, I instantly and I know that young people have strokes, but I think about older people. I mean, that would easily, that's an easy connection to going, okay, strokes, and there's bacteria, and 86% of the people who had their clots diagnosed or whatever. Well, we should be educating our parents and making sure that they're getting regular dental visits and that their mouth is clean.
It's part of the body. It really is. And so again, the whole idea is let's prevent whatever we can prevent. And this is it's very inexpensive. Dental care is not expensive. Dental neglect can be very expensive. So if you spend that 5 to 7 minutes doing what you're supposed to do every day, you can really cut down on issues. And when a person has a stroke, it doesn't affect just that one person. It affects the entire family. Everybody's life is turned upside down. They can't take care of themselves like they used to. And maybe they can rehab to where they can, but boy, it sure takes a lot of visits to rehab and a lot of doctor's visits and a lot of avoidable pain. So
that just shows that it's traveling. It's making its way through. 86%. It's just unreal to think about that number.
Well, there was a study earlier where they took 40 blood clots out, and they wanted to analyze to see if they had any oral bacteria. All 40 had oral bacteria in them. So it's not rocket science.
Wow.
It's
Right.
pretty basic stuff. And yes, there are
Wow.
excellent researchers that are getting into the absolute details of it. But just from a layman's standpoint, is it okay to have pus going into your arteries, into your veins? And the answer is no, it's not.
Yeah. I think a lot of times when we think about going to the dentist, our in my mind, I'm thinking, okay, a pretty smile, and then everything else is below that. But that's not your priority, is it?
Well, when you think about a dentist, you got smile, you got chewing, and you have speech, and those are three things that we want to make sure you can do. Because when you lose your front teeth at Christmas, so speech does have something to do. But there's three areas outside of the mouth that we really have to think about. Number one is infections, and that can be either from the gums or from the teeth. So you have periodontal infections from the gums, or dental infections from the teeth. The second thing is airway. If you don't have air going in there well enough, you can have some type of sleep disordered breathing. You need to get checked for sleep apnea, see if you have that. That affects your overall life, and it can actually kill you. I had a buddy of mine back in the 80s, 37 years old. His wife said, "Go wake up Daddy," and Daddy was gone. And horrible. That's the ultimate. The other is you got high blood pressure, you can't get it under control, you're feeling sleepy, you doze off at the wheel. That's not always good, And the last thing, so you've got infections, airway, and is the bite, the way the teeth come together. Because if the bite's off, it can cause headaches, neck aches, a lot of other issues. So it's funny, I've done occlusal adjustments on people, and depending on what's causing their headache, if we know the bite is off and we take care of that and they come back and say, "How's the headaches?" They're gone.
Wow.
So, what medicine did it take? Nothing.
Yeah.
Just getting the bite right. So those are three areas outside of the mouth that are affected by the mouth.
Wow. All right. Well, we're going to come back. Kathy's got a great question. We're going to hit up the question of the week.
Thank you.
Here's Dr. Chuck's question of the week.
Hi, Dr. Chuck. Why do I need a water irrigator?
Very good question. We're going to send you one of your filthy mouth mugs. And if we use your question, we'll be sure to send it to you also. But there you go. What's so important about a water irrigator, Dr. Chuck?
Well, I love directed water irrigation. When you use dental floss, it's real easy to miss a lot of different areas. And I'm not against dental floss, but it's a part of the regimen for...
It's a tool.
It's a tool,
Yeah.
absolutely. If you... Like the one Dr. Pankey said, if the only tool in your toolbox is a hammer, everything looks like a nail. So you need to have the right tools in your toolbox. So the nice thing about directed water irrigation is if you can aim that water directly in between the teeth, and actually you put it on high, not on low, on high, but you're not aiming at the gums, you're aiming it over the top of the gums.
Okay.
And you're letting that water run there for at least 5 full seconds. So you want to use as warm of water as you can comfortably tolerate. That opens things up.
Okay.
But now there's something called the Venturi Effect. Whenever you have a flowing fluid, it creates a negative pressure or suction right next to it. And when you shoot that water in between and you leave it there for at least 5 seconds, you literally suck out from the bottom from down deep into the pockets. With toothbrush and dental floss, you can only get down 1 to 2 millimeters under the gums. With directed water irrigation, you can get down 5 millimeters, and some even say 6 millimeters under the gums, but you have to do it the right way. And again, you're not aiming it into the gums. It's not a power washer.
Right.
It goes over the top of the gums. Waterpick actually did a study that showed that when you brush your teeth, you're only getting out right around 20% of the bacteria that's in there. When you brush, floss, and rinse your mouth out. When you use directed water irrigation, you're getting out close to 90%. So, I mean, it really makes a huge
incredible.
difference. So, am I a fan of direct water irrigation? Absolutely. Am I a fan of electric toothbrushes? Absolutely. Am I a fan of anything that's going to help you get your teeth clean without damaging the tooth or the gums? Absolutely. And they may come up with some new inventions down the road that'll make it even easier for us. But yes, directed water irrigation, water pick, shower breeze, any of those products out there that are going to help you get the bacteria out of your mouth. Again, I don't want to just rearrange the furniture in the mouth.
Right.
I want to get the furniture out of the mouth. And directed water irrigation is one of the best ways of doing that.
You know, it's so cool. Education is so important because I was visiting a friend this weekend and conversation came up about this. Strangely enough, we were talking about water picks and water irrigation, and she came home that day with one. So it's like just the knowledge that you're giving to me and to, you know, our viewers and everything. It's not just for us. It's our friends. It's our network. It's the people around us. You want us to share the news. You know?
And this is for, I want you to be a dental missionary. I want you to tell your family, your friends, let them know, because our goal is to, let's cut down on oral disease so that we can cut down on systemic disease. And the two go hand in hand.
Thank you. So today's show, we're talking about blood clots and oral care. And can you just kind of reiterate as we wrap up what the doctors found as they extracted the blood clots from people just in the rest of their body, that, you know, how oral health was tied into it?
I'll read you their conclusions. Okay. This is the first study showing the common presence of bacterial DNA from Viridans streptococci, those are bacteria in the mouth, in aspirated thrombi, that's the blood clot that they took out, of patients with acute ischemic stroke. Streptococci bacteria, mostly of oral origin, may contribute to the progression and thrombotic events of cerebrovascular diseases. So what they're saying is oral bacteria can affect blood clots and can affect cerebrovascular disease.
And it also sounds like, did I not hear you say this is the first study that they've done this in?
That's what this says right here.
Wow.
And again, this was April the 5th of 2019.
So we're just in the very early stages of understanding this, but really the more we learn and dive in, it's not just strokes, it's heart, it's Alzheimer's, it's pregnancy, it's affecting every part of our body, this mouth bacteria.
Well, it's hidden behind the curtain of the lips. And if you could see what's going on, you know, if you just pull your lips back and take a look in there, a lot of you would be shocked. And but if we don't see it, out of sight, out of mind. And so,
especially if it doesn't hurt, like you said.
Yeah, one of the major reasons for bad breath is periodontal disease. Periodontal disease doesn't hurt. There's no pain in it. According to the Center for Disease Control, over 70% of the population that's over 65 years old has periodontal disease. That's just not an inflammation of the gums. That's going into the bone as well.
Wow.
So it's a big deal. It really is.
It is. Well, we want you to go to yourfilthymouth.com, pull up the white papers that we have on there for you. Like you said, we're not making this up. You're just the messenger.
We're the messenger,
right?
Yeah. I'm not the researcher.
Thanks for joining us today.
Thank you.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.